Good afternoon. I'm George Latimer, Westchester County Executive, and I'm here with Deputy County Executive Ken Jenkins for our second coronavirus update of the week for Thursday, January 21st. I'm joined also by Catherine Chaffee, who's Director of our Communications Department. Joe Scamato and Lisa Reyes are with us here, and we're very happy to be able to try to continue to provide you updates on where we are with the coronavirus outbreak and now with the vaccine distribution. We have historically led with information about the extent of the virus infection and the different numbers that are involved, but because so much discussion is about the vaccine, we'll start with our vaccine information. First of all, through yesterday, day ending Wednesday, January 20th, we have two locations that the Westchester County government is directly involved in vaccine distribution. Westchester County Center, which is run by the state, but for which the county government is a partner. It is our facility, obviously. We have staff over there that are helping to man it. And we have hit 8,667 individuals vaccinated so far during this process. It opened a week ago yesterday, so roughly 8 days and 8,600 vaccines. We're hitting about 1,100 a day as an average, which is a good number. It's the single largest place of vaccine distribution in Westchester County. Obviously, we have a facility that's sized properly and was built different hospital bays for backup hospital use, so those lend themselves to the vaccination process very well. And we think that that process is going well, but keeping in mind that right now we are still giving vaccines as a state to people who fall in very specific categories. It is not yet open to the general public below the age of 65. The other location that we're involved in directly is the White Plains County Health Clinic. It's on Court Street here in downtown White Plains. And total, since we opened that facility, which we opened earlier in the process, it's much smaller physical environment, we've vaccinated 2,207 people. So the aggregate between the two, we're over 10,000, almost at 11,000 people who have been given the vaccine directly through Westchester County sources, and that is as of yesterday. So today we've had no doubt a robust amount of vaccines giving out, going over the 11,000 mark. Now, there are many other places in Westchester County that have been given the vaccine, and we have asked for and gotten a list from the New York State Health Department of other places that have been assigned vaccine product, and that would be some local pharmacies. The list is going to be up on our website, westchestergov.com. This is not a place to go to make an appointment. This is a place to go to look to see which types of facilities have been given out the vaccine. You will see, obviously, the Westchester County Department of Health on that list. You will see some local pharmacies in different parts of Westchester County, and that will also highlight some of how the state is planning this distribution. But there are issues at hand right now at the federal government level about availability of vaccines. These things are playing out at the national level and the state level of government. Those of us in county government do not have direct influence or control over them. We will work with the state through their direction once these things are sorted out. We do know that if we get sufficient vaccine, we can continue in the two locations that we have responsibility for to give out the vaccines, and I'm sure that's true for the pharmacies and the hospitals that are also part of the process. But for transparency's sake, we will be, I'm not sure we're up yet, westchestergov.com, you'll be able to see the other locations that have given out various amounts of vaccines. The numbers are fairly low as they're being allocated out to pharmacies and so forth. The vaccine distribution, however, follows a basic format, and I know that you're hearing from your friends, I called this person and this, I went into this city, I went to upstate New York, or I went to Florida, and there's a host of different ways that these things might have been structured. We are following the state-regulated structure, which requires you to go on to a state website to be able to fill out a COVID-19 vaccine form. And when you complete that form, you should be able to access into the state system to look at available spaces. The inability to provide appointments is because of the inability that we have at our level to guarantee that we will have vaccine product to meet that appointment. It would be worse than not making an appointment, not being able to make an appointment, to make an appointment and find out that we can't honor that appointment because of lack of product. Not to mention, we have any number of people who will have gotten the first shot needing the second shot in a defined period of time, and not knowing if they're going to be able to get that shot or not. So we're working with the state. We're trying to do our very best to make sure that we accommodate the people that come through our doors with the appointments that we've made, and we're certainly trying to be as helpful as we can be to the general public to let you know both the urgency of this, because there are people out there who don't want to take the vaccine and have to be convinced, I guess, to do that, but also to try to get out the public information that we can share with you relative to vaccine distribution. And it's difficult. We are still in phase 1B, which includes everybody from 1A and 1B, 65 years and older, eligible for the shot, with certain compromised health issues, eligible for the shot at any age. People who work in specific areas of necessary employment, essential employment, all first responders, teachers, a variety of medical professionals, doctors, dentists, optometrists, and so forth, right down the line, bus drivers, a host of those people eligible for the shot. Those who are not eligible for the shot under New York state law at this point would be people under the age of 65 who are healthy, do not have a health crisis that requires them to be vaccinated. And that is by far the largest number of people in our society. You are waiting patiently to get the word that vaccine is available and the door is opened up to all people to get those shots. And it may not come all at once. They may determine that they're going to do it in age cohorts. We don't know. It is logical to think that the flow of people would probably be limited by opening it up in stages, arguably 50 to 65 first, and then below that in phases. But that is not a public policy that's been stated by the state yet. We look for governor's comments each day to try to discern what the state policy is so that we at the county level can implement it. But the most important thing, and we have these informations below on the screen, the vaccine hotline number exists. 1-833-697-4829, 1-833-697-4829. This is the vaccine hotline that you call, state structured. The state has the vaccine forms, which you can check on at forms.ny.gov, and you'll see on the screen the / information that gets you right to the specific form you need. And that if you're not sure if you're eligible, I think I pretty much laid out eligibility pretty clearly, except you have to decide what's an essential worker. But COVID-19 vaccine, what you need know is the third area. Each of these things are going to be spotlighted and made available for you to look at. We are going to have, I'm going to jump ahead for something that we would talk about a little bit later on. I will be hosting a town hall here on Facebook tonight where the public can ask questions related to COVID. We've done this before. And tonight when we do it, I'm going to have Dr. Dial Hewlett from our County Department of Health will be on the line. He is expert in this area and will be able to help answer questions at a certain level of scientific and medical specificity. I'll have with me as well 3 of our prominent mayors, Yonkers Mayor Mike Spano, New Rochelle Mayor Noam Bramson, and Mount Vernon Mayor Sean Patterson Howard. Mayors of the big cities and village mayors of the bigger villages are all on the firing lines for the COVID crisis. And so we want to make sure that they're part of this team to dialogue, and some of the questions that will come out may be community specific, and we'll invite the mayors to share their thoughts as well. This begins tonight at 6 o'clock, goes to 7 o'clock on Facebook. You can ask questions online in the comments section of the Facebook coverage, or you can also email them to communications@westchestergov.com. Catherine Chaffee, members of her team will be available to try to help cluster those questions, and we're not going to be able to answer a specific question about a specific person. I called on the 5th, and how come I don't have, we're looking for general information questions that can resolve issues. If you have a specific question and you email it to communications@westchestergov.com, we will have somebody call you back and deal with your specific information. But when we are up on Facebook with the mayors, we're going to try to handle the general questions that you have about COVID-19 within our ability to answer them, because the program is structured through the state, governors in charge, mayors and county executives are all pretty much in the same boat trying to implement these things. But that's tonight, 6 o'clock on Facebook. So I'm going to ask Deputy County Executive Ken Jenkins to cover the next area, which involves vaccine mental health, an important issue, and then we'll come back and give you statistics and some more information. Deputy County Executive Ken Jenkins.
Thanks, County Executive. We are so happy that we are been able to pull together a public service announcement that is really focusing on mental health. Let's take a look at that now.
COVID-19 affects everyone. Tell us how it's affecting you.
Struggling to cope.
I'm here to listen and understand.
Call 914-995-1900.
Feeling anxious or stressed?
I'm here to provide compassionate support.
Text 914-461-7281.
Depressed or worried? I'm here with Quality Care.
Click mentalhealth.westchestergov.com.
Don't know where to turn?
I'm here to connect you to the right help.
Reach out for assistance. Call, text, or click today.
We're here.
So that public service announcement is really critically important because as mental health was an issue prior to COVID-19, the pandemic has just exacerbated the situation. People being able to be locked in their houses and not being able to do the things they normally do has increased alcoholism and drug abuse. We certainly have had issues where people have had mental health issues and crises throughout the pandemic, people that have been in their homes and not being able to go to work, not being able to hug their loved ones, not being able to see family members. Certainly the loss of family members and friends and not being able to grieve the same ways that we normally could grieve, sometimes not even being able to go to a wake or a funeral and be able to hug your friends and families and neighbors to just show them the love and let them know what's going on. So because of all of these losses brought on by the pandemic, we're facing many, many new negative scenarios for the first time. So this particular public service announcement is pointing to the services that Westchester County has been offering through its partners and throughout the state and the country to make sure that we're focusing on mental health issues, letting people know it's okay to say you're not okay and to be able to reach that out. It doesn't matter your community, it doesn't matter your ethnicity, it doesn't matter your income group, doesn't matter any of those things. Mental health issues are real and people have not had an opportunity to get the services that they need. This public services announcement is showing clearly that Westchester County and the County Executive Latimer's leadership continues to be at the forefront of making sure that we're providing all the services that we can possibly do for all of the members of our Westchester community. A lot of these times we develop these public service announcements and there's professional actors in this. In this case, all of the actors that are involved, actors and actresses that are involved in that are Westchester County employees. Certainly, we thank all the members of the county workforce that submitted their names to participate in this, and you saw the results of that. It is an outstanding result for the people of community mental health. Our community mental health department, led by Commissioner Michael Orth, has been doing a tremendous job throughout the pandemic. There are videos that are already existing, but this is another way of making sure to reach out to our community to discuss this real issue of community mental health. Be out on the lookout for that. You'll see that coming on. And the numbers, I believe, are on the screen to be able to reach out to our community mental health, whether you call, you email, or you even text. Make sure you get the help you need. Thanks a lot, County Executive.
Thanks, Ken. Thank you very much, Ken. We'll take a quick look at the numbers based on the tracker information from New York State that came today. There is a county tracker that provides information about the number of cases, does not provide some of the information about hospitalization and deaths. As I've said oftentimes, we need to have that information released to us from the state in order for us to share it on our database. But you can access information every single day, any time of the day, by going on to our dashboard. And that information will be available on the screen over the course of our presentation today. So as of today, Thursday, January 21st, we have 11,470 active cases of COVID-19. Now, the active case number is not shown on the state dashboard. That number is a function of looking at the total number of people that have been infected since the beginning of the pandemic. And that number is on the dashboard, 86,646. And we subtract from that the number of people that tested positive as of 2 weeks ago, 75,176. The 11,470 number actually represents, at least for the last week or so, a flattening of the curve. We have not continued to expand quite as aggressively as we had previously. And we talked about spikes from Thanksgiving, from Christmas, and from New Year's Eve. The New Year's Eve 2-week period of time would have ended about a week ago, or a little, roughly a week ago. And so the flattening may very well be the example that we got a spike, and now without that special event in which people clustered in private settings, we're seeing a flattening out at that point going forward. So hopefully that's a good sign. At 11,470, we're down from where we were the last 3 or 4 days. We were about at that number on Sunday. We went up a little bit on Monday and then have come down the last 3 or 4 days. A week ago, that number was slightly below today's number, 11,208. That's pretty much a flat number. 10,000 2 weeks ago and 8,500 3 weeks ago, which was the last day of the year, the year 2020, just before we went into New Year's Day. So we have a long way to go. We hope that the flattening is a good sign. The last hospitalization number I have is 567 individuals hospitalized to COVID. We're closing in on the 600 number. That is about half of the number of people in our peak period that were hospitalized. Back in the spring, we had 1,200 people hospitalized. We're still well below the number of beds in Westchester County with a number that approaches 600, may actually be over 600 right now. But that still is a very high number of people. These are folks who are sufficiently ill as to require hospitalization and hospital care. We have lost now, year-to-date, 1,824 individuals to COVID. We lost 5 overnight from yesterday. We lost 13 the night before that and 9 the night before that, 8 the night before that. So those numbers are not insignificant. And when we compare where we are this week to where we were a week ago, it's a rather significant number. We have 61 people that have passed away in the last week. And those are Westchester residents. Those are people who were alive, ill, and struggling a week ago. 3 weeks ago, may not have even been ill. And so that is the nature of COVID. It strikes in ways that isn't easily predictable. And people who look like they might be able to fight it off don't. And some people who look like they might succumb to it manage to successfully fight it off. And it really comes down to protecting people from getting it in the first place, which is the purpose of the vaccine now that it's out there. But those statistical numbers are being broken down on our dashboard in terms of case numbers by municipality. They generally follow the population. So if you're looking for absolute numbers, you will find more in Yonkers because there are more people in Yonkers. You'll find less in Pound Ridge and Buchanan because there are less people in Pound Ridge and Buchanan. The more urbanized areas, and that includes villages, not just cities, the higher the concentration of people, the higher the concentration of infection. The governor has not made any changes to his color-coded zones, which are now about 5-6 weeks in duration. Westchester still has Portchester in the orange zone, and then yellow zone designations for sections of New Rochelle, Yonkers, the Tarrytown and Sleepy Hollow combination of communities that are side by side, Ossining, and Peekskill. Yellow zone designation is the lower of the 3 zones. There are certain requirements that make limitations. In restaurants, indoor dining is permissible, but no more than 4 people at a table. In orange zone situations, the restrictions are somewhat greater. The percentages are left a little bit lower. It was changed for restaurants to open up so that restaurants in the orange zone, again, only affecting Portchester at the moment, would be similar to a yellow zone scenario, and that has helped open up some of the restaurants in Portchester. But all of our restaurateurs, our hospitality industry folks, are suffering mightily because those are the types of expenditures that fall off from people's budgets when they're having economic issues. They don't spend the extra money going out. They don't spend the extra money staying overnight in some travel situation, or they don't have as much tourism coming in. So we look at those situations. If there are any changes in the zones, we certainly will share that with you as we go forward, and we monitor that closely within each of the different communities. With a new president in Washington, President Joseph Biden, taking office yesterday, he is putting his coronavirus team in place. They appear to be very well-qualified individuals who will work together to try to help us in ways that we need help. And at the local government level, for that matter, at the state government level, what we desperately need is more vaccine product being brought into our communities. Now, everybody's in the same situation. You'll hear this story everywhere across the country. If you turn on nightly news tonight, they'll spotlight places that are 5,000, 3,000 miles away from where we are right now that have the same ask. And that tells me that the issue is not localized, it's not regional, it's not statewide, it's a nationwide problem. We can't expect the new team that comes in the door yesterday, and they're not all in yet, to immediately have answers for this. But this is the key challenge. And the federal government has certain responsibilities, as does every level of government. We have ours. We are tasked with running a social services department and a county jail and certain transportation functions and so forth. And the federal government has the position and the structure to do other things, and in this particular case, deal with those corporations that produce a variety of different products, in this case pharmaceutical products. But at the same time, the Defense Production Act gives the president, the national government, the ability to transfer the way manufacturing is working from one set of products to another set of products. I had the opportunity today to interact with some folks in the healthcare field, and they talked about, why do we have to rely on PPE production coming from China, which is right now the major producer of PPE, personal protective equipment, the masks, the gloves that are used in a healthcare setting. And if this is a priority to attack, then it's a priority to use that authority, that Federal Defense Production Act authority, to make sure that we have a domestic source of PPE as well as domestic source of the other items we need, which particularly involves the vaccine, but involves other things that are necessary. There's an executive order that President Biden has written, a sustainable public health supply chain. This directs the development of new pandemic supply chain resilience strategy. These things are important. They have to be identified as policy, and then they have to be implemented. Easy to say, hard to do. I know at our level of government, we can sit and have a policy discussion, agree that there's a certain direction we need to go in, but understand that to actually accomplish the task, it will take time and effort and money and a host of other things that have to come into play. But we welcome the new administration. We hope that the new administration will prioritize the battle of COVID, as we know has been needed now ever since this first happened. And if we get that attention, then we'll get some progress along the lines that we will talk about. I've also interacted with the state government, indicating that we would welcome additional vaccination areas in Westchester County. The Westchester County Center might be unique because of the size of the facility and that we could dedicate it for the vaccination process. But I think all of us in Westchester County government, this is not about legislative, executive, or county government, municipal government. I think we all recognize that we need additional centers like the county center in different parts of the county if we're going to truly vaccinate the vast majority of Westchester residents. So certainly a vaccination center in Yonkers would be welcomed, a vaccination center in Peekskill, or in that northern corridor, northwestern corridor that would include Cortland, maybe Yorktown, Peekskill, a location in the northeastern part of the county. Generally, Mount Kisco serves as the hub of northeastern Westchester. In addition to Yonkers in the southwest corner of the county, New Rochelle, Mount Vernon, south central and southeast corners of the county would all be helpful. We have in White Plains 2 facilities, one large one, one small one. We need additional vaccination centers, and if the supply line can provide us the vaccine, we're certainly working with the state. We will definitely try to put on more of these vaccination centers. I hear from a number of our local elected officials. Supervisor Matt Slater from Yorktown made this direction and offer, and so have other mayors and supervisors, that we need to be able to get the vaccine out in as close to a location to people as where they live. And to some extent, it's for poor people that may not have transportation, but it's really for everybody, because the easier you make it for someone to get the vaccine, the more likely it is they will take it. And that is really what the mission is here, which is to get people to take the vaccine. And then I also want to add one other note today before we go to whatever questions we may have from the press. A note of congratulations to U.S. Senator Charles Schumer. Chuck Schumer has been a regular visitor to Westchester County. He has represented us in the United States Senate since 1999. And he certainly has been present in Westchester for a host of different things. He has been a source of support for the things that we believe in, getting us resources as necessary to help us accomplish tasks here, and also fighting on issues like trying to reverse the SALT tax deduction. The loss of that deduction would just hurt taxpayers all across the state, and certainly in Westchester County. And now Chuck Schumer is going to be the Senate Majority Leader, is the new Senate Majority Leader. So we welcome him to that position. We wish him great good luck. Again, he's been a good friend to us, and he also has a reputation of getting around the state pretty amazingly. We try our best to do that around the county of Westchester, and not just by Zoom at this time of the year. And when you have 25 towns separated by as much as 35 miles, that's not easy to do. He gets to all 62 counties every year. Now, I have an anecdote. When I saw him in Westchester for breakfast one morning, I was on vacation. After that breakfast, headed up to the Adirondacks. That night on TV, I saw a picture of him in one of the upstate Adirondack counties doing some event that he must have left Westchester to go to do. So he certainly is a person who is visible in all parts of the state. But it's not just visibility, and it's not just long tenure. It's a sense of accomplishment. And now, as a Senate Majority Leader, much the same as our neighbor and friend Andrea Stewart Cousins, is the state Senate majority leader. He is in a position where he can do a great degree of good. We wish him the best. We hope to be good partners to him as we have been in the past, and we're pretty sure we'll be the beneficiary of his tenure in the Senate as he goes out to do those things. We wish him well. With that, we'll check Catherine Chaffee to see what questions we have. Catherine.
We have a number of questions. The first question comes from Samantha Crawford from News 12 Westchester. Should people who've received their first dose be worried about not getting their second?
I think there's an effort now, Samantha Crawford from News 12 asked the first question. I think there's a concern, and the concern is driven around whether or not there's a reliable stream of product that comes our way. But I think in each of the cases, we are trying to make sure that anybody who gets the first dose has a reserve second dose waiting for them, because we would negate the benefit of having given out first doses if the second doses don't follow. The second dose gives a significant activation to the first dose. And I've heard numbers that say, you're maybe 50% protected after just one dose. That's not adequate. You can still get the disease. And the purpose here is to not get the disease. So the second dose is essential. We have to, and the expectation is we will deal with that. Certainly in the areas that we control, we will do that. I think that's the general sense. There have been some issues out there that dealt with particular circumstances where a particular area gave out doses and maybe isn't going to be open to do it for the second time around. We are going to work with the state to try to figure out how to make sure that everybody who got a first dose gets a second dose, and so that at least those people we can check off the list as we try to get through all 1 million Westchester residents.
The next question is also from Samantha. Governor Cuomo said yesterday that New York will run out of COVID vaccine doses in a matter of days. How many more doses are left at the county health department vaccine site and at the site of the county center?
We don't have numbers on that, and if you'll forgive us, Samantha, if we did, we don't know that that's an appropriate transparency situation. We do not want to cause panic. In most cases, we are working to try to get sufficient dosages that will satisfy every commitment made. So, if we use dummy numbers, if we had 10 doses and we know that that's enough to get us through the next 3 or 4 days, but we didn't know what was going to happen on the 5th day, we wouldn't press the panic button and publicly announce we may not have the thing. That would set everybody crazy. We think the proper thing to do is to work to get the additional doses, to emphasize how important it is for us to have those doses. So forgive me if I try to focus on trying to solve the problem, which is getting the doses for people rather than identifying our concern, which is a legitimate concern, that there won't be sufficient doses to do this. But I have to tell you that we have to keep people informed, but we also have to keep them focused on what's most important, which is you must sign up to get the vaccination. That's the focus. Don't, all of these other side things that make you worry will only set you back from what your task is. The focus task is get an appointment, meet the appointment, you'll get the dosage. We will do everything we can to make sure we honor that.
Okay. And the next question is also from Samantha. President Biden's COVID plan calls for 100 million people to be vaccinated in the first 100 days of his administration. Do you think this is achievable?
Well, it's achievable if the national production level from the pharmaceutical companies and the distribution at the federal level does it. We have people ready. We have the needles ready. We have the physical location ready. And we need the vaccine. And if the vaccine comes in, we will continue to do 1,100 people every day. We'll try to stretch that out a little bit at the county center. And I know that any of the pharmacies that are on this list will do their dead level best to get out the product. So it is doable, but the issues are at the top of the pyramid. We thought we had a stockpile of vaccine, then we found out, I think, a few days ago before the old administration left, no, there really wasn't that stockpile. I don't know the specifics. All I know is that we thought we were in better shape than we were. Now that we know the truth, that we have to hustle, then we have to hustle. And the sense is that I think that the Biden administration is making this a priority. This is not a sideshow discussion. We're not, they're not trying to minimize how bad the disease is. They are focusing on what should have been focused on all along, which is now that you have vaccine, how do you get vaccine out to people? So if they can accomplish at their level, we can do at our level what's necessary, which is making sure that once given the vaccine, we get them into the arms of the people necessary and go through that process. It is an aggressive goal. It's a very aggressive goal.
And the last question comes from David McKay Wilson, different topic from COVID, but he asks, the PSC announced a $1.5 million fine on Con Edison regarding Isaias storm response. What is your reaction to that?
Well, a fine to Con Edison, or for that matter, any other entity, is part of how the PSC responds to this. I would prefer, rather than fining Con Edison, that they take that 1.5 number and channel it into reduction of the bills of the people who are Con Edison users. To punish them, and it becomes a matter of a subtraction on their balance sheet, doesn't make the emphasis that people were put out of a convenient situation by losing power during ECES. And there were many people who called our offices and other places. They were in dire straits not having power. So I think that if the PSC is going to fine Con Edison, the fine should be repaid by them reducing, by revenue, same amount of money, reduce the amount of revenue they receive from ratepayers and give an across-the-board reduction to ratepayers as the punishment, if that's what this is, for failing to respond appropriately. Very good. Well, if there are any other questions from any other members of the press, feel free to direct them to Catherine Chaffee here at our communications department, communications@westchestergov.com. If you pick up the phone and call us, you might get Catherine Chaffee, you might get Joe Scamato, you might get Lisa Reyes, you might get Chelsea Pagano, and very soon we'll have back in our midst Carolyn Fortino McMillan, who's the mother of a proud little baby girl. We expect to show her off in the appropriate fashion when mom and daughter are with us here. But our team is working very hard to try to help connect with the press on issues that they need in a timely fashion so that we can be, as I've said, as transparent as possible. And in some cases, we don't have the information the state does. If we can get it, we'll share it. If we're not given it, or we're told we can't share it, then we won't. And in a few other cases, we want to make sure that the information we share is productive toward our goal, rather than creating a sense of frantic panic, of which there's plenty of it out there now. I'm on various Zoom calls and see that. Just as a closing comment, the last couple of days I've gone through a couple of healthcare checkups myself. I've been in to do a number of different things. The 50,000-mile thing that you take your car in for. This is the 67-year-old update of the vehicle. And I have to tell you, what impresses me tremendously about our healthcare system are the number of professionals that I've met. Women who are there, men who are there, doctors of all type, nurses, people who take blood, people who could sit there and explain to you the details of an issue. I might know something about what I do for a living, but I know very little about medicine, and certainly when it relates to myself and my own personal health. As you sit there with somebody who's knowledgeable in ears, nose, and throat, a dentist, dermatologist, all the different expertises they have, it is remarkable to me how professional the medical profession is. And, I'm very tempted to thank all the doctors I've dealt with over the last few days, just as I've gone through this normal checkup. No particular health care concern, but just a checkup. But it reminds me that the medical system in Westchester County is exceptional. And the people who do that work are exemplary, and we owe them a debt of gratitude. We can only give it in this point, generically, but in a personal level, as I went through the few things that I did over the last few days, I was very appreciated, and I told the doctors and the nurses how much we appreciate it. They are the bedrock that this is built on. When we give out vaccines, we have trained people to give out vaccines. I took a shot today for pneumonia, and who wants to take a shot if they don't have to? But the people who do it are professional, and what they do will save our lives. What they do will extend the quality and the length of our lives, and we should be very grateful for that. I personally am grateful. I hope you are too. If you have somebody in the family, or if you are a medical professional, thank you. And if you know somebody who is, make it a point to thank them for their service. Everybody does something for a living, and what everybody does contributes to the overall economy in some way, shape, or form. But where would we be during this pandemic if it wasn't for our healthcare professionals? So thank you all very much. Thank you for watching. We will be back next week with Monday and Thursday updates on COVID. If there's a reason for us to come back sooner, we will. And if we have any other information to our friends in the press who may be watching, we'll try to communicate that to you directly. We'll be back on Facebook tonight at 6 o'clock with the three mayors, and more importantly, Dr. Dial Hewlett, to take questions on COVID, hopefully helpful. And we'll look forward to seeing you the days ahead. Take care and stay safe.